That is absolutely amazing. And you rest your head down on there, darling. How's that? Okay. Okay.
24 hours a day, Tony relies on a machine to help him breathe.
It was your daughter I spoke to on the phone yesterday as well. She was awful lovely. She's taking very good care of Carol. Oh, right.
The CPAP device maximises oxygen without the need for ventilation.
Even lying over on your side is making a big difference, Tony, okay? So if you can stay over on your side, that will be really helpful, sweetheart.
It is uncomfortable, at times painful.
It feels like you've a very, very strong wind blowing in your face all of the time. Ordinarily, we would have used it just for maybe a short period of time and a break off it. We can't do that with COVID. They're on it all of the time or their oxygen level is compromised. I think 22 years qualified now, and this is without question the hardest thing I've dealt with.
Tony is in one of 4 high dependency beds in a ward that normally treats infectious diseases.
How's the breathing?
Fine, my eyes is definitely steadied up, so a lot better than it was
Good.
3 days ago.
Good.
Along the corridor, Mark is recovering. 10 members of his family tested positive after Christmas.
I knew something wasn't right, and then Tuesday morning I really panicked. I felt as if I couldn't get a breath at all, so I ended up here. You probably don't appreciate just what this disease does to you, because I'm probably say relatively fit, early 50s now, and just over the last 3 or 4 days, last week, you just feel your breathing getting shallower, and you're thinking, this is a wee bit more than just the normal cold, or no. You see it in the telly, like everybody else. You read about it and hear about it, but you don't actually probably appreciate just how it can affect you,
This unit is already at capacity. They're having to make space for another patient expected shortly. The physical and mental burden on staff is plain to see.
We see people dying who never thought that they could get coronavirus. We see family members upset, distressed, distraught at the fact that they have even given their family member that coronavirus that has made them require high dependency care.
What kind of toll is this taking on you personally?
Sometimes you find yourself going home at night and you reflect on the day and you think, this isn't normal. This isn't normal life. We're seeing far more deaths than we would ever have seen.
Is there anything in your experience and your training that could ever prepare you for something like this?
I don't think any of us can really prepare for that, but we just have to do our best. These resources are finite. We don't have an unlimited number of CPAP machines, an unlimited number of high dependency beds, an unlimited number of intensive care beds. It's really important that people follow the restrictions, protect yourselves, protect your families, and protect the NHS. We're doing our best, but we need your help.
Despite the fatigue, they keep going.
It's soul destroying. It really is. I've gone home from work and cried so many times, and I've thought, is nursing really what I want to do? And then I come in and we're a great team. It's like an extended family. So we all get each other through the shifts.
I can see just walking around the hospital that the staff look tired. They tell me they're tired. Some of them tell me that they're at their end point and they don't know where they're going to get the energy to get through this next peak. But many of my senior charge nurses, they are so committed to their role and so committed to looking after their teams that they'll tell me I just need to get through this, but I can see that, they are struggling.
What is clear is this is a system under strain like never before. The pressure on staff is already immense, and they're now bracing themselves for COVID admissions to escalate even further in the coming weeks.
This week, NHS Lanarkshire postponed non-urgent elective procedures to focus on COVID patients.
We're having to open beds that we wouldn't normally have the ability to do. We're having to take down all planned care that we wouldn't normally do. So these are unprecedented times. I think everyone realises that. The number of layers of pressure are unprecedented, and we're having to run things differently to how we normally run things. So all these things add up to pressure like we have never seen before.
A&E is also busier than ever.
We wait in fear of what comes ahead of us over the next couple of weeks. I feel that we are on the brink of moving into possibly the most stressful time period of our working careers here in the department. But it wouldn't take much more to push us over the edge on a very busy shift when there's maybe waiting times of up to 7 hours, which sometimes that would make you feel a little bit ashamed that a waiting time could be as long as that. But there really is nothing else that we could be doing to try and look after our patients as quick as possible.
The vaccine offers hope, but feels a long way off.
Patients are sicker that are coming into us are spending longer periods of time in hospital. That's got the knock-on effect that if we're not creating capacity further down the line, that capacity then affects the A&E flow and the receiving flow. So we need to create capacity all through the hospital, but it's very difficult given that our patients are sicker.
It's not easy.
I know, but we're fortunate, aren't we? At least I can see you.
It's not easy.
At least I can see you, do you know what I mean? I don't know.
Back in the High Dependency Unit, this is the only way patients can see their family. George McGee has been here for 5 weeks.
How's your sore lips? Are you wearing your lip now?
Aye, it's there.
Good.
It's there.
You just keep putting that on.
I was 65
Last week?
last week.
He celebrated his birthday the same way he celebrated Christmas, alone in a hospital bed.
At least I get to see them. See that, and you don't see them at all. You know what I mean? You wouldn't get to see them at all. So it's an enormous difference. Who would ever have thought when they built this place, a window would be so important?
Tomorrow, tighter restrictions come into force in Scotland. Staff here can only hope people heed the warnings to help avoid the system being overwhelmed.